In this respect, I'm referring to the social and structural forces that operate on individuals, groups, and communities in which they are defined and recorded particular ways that exact social and human costs. And I'm interested in examining the social and human costs of making these kinds of distinctions between these art. And in my talk, I will examine how these social structural factors and forces operate on particularly vulnerable populations here in the United States. One we just heard about the vulnerable population, not just the but many Middle Easterners who find themselves not necessarily as their first choice that had to come here, and the particularly vulnerable population I'm looking at is maybe and so I also want to introduce this concept of structural vulnerability as a powerful way of describing and explaining the plight of those who are structurally vulnerable. And this idea comes from critical medical anthropology. And various schools of thought have placed a great deal of emphasis on the social production of disease and distress, and as well as tries to really examine this phenomenon of social suffering and understand that in terms of the continuums of violence that people experience. And so, and this idea of structural vulnerability really largely emanates from Paul Farmer's work that comes from his conceptualizations and ideas of structural violence. So let me just say something here about structural vulnerability. Individuals are structurally vulnerable when they are subject to structural violence in its broadest conceptualization. This includes the interface of their personal attributes, such as their appearance, their affect, their cognitive status, with cultural values and institutional structures. Economically exploited and politically subordinated individuals and collectivities often internalize their externally generated depreciated status in a complex and poorly understood process of embodiment that shapes their behaviors, their practices, and their self-conception, their habitus and their subjectivity. So before I go on with a more thorough explanation and definition of structural vulnerability, let me read to you what are some of these unambiguous examples of structural violence at work with respect to undocumented Latino laborers. And so this is something I put together for a paper that I'm writing, or that I've written and submitted, and it's a little bit dated, but the points are well taken and are very much alive and well to the state. I call this dispatch America. Alabama requires schools to check students' immigration status. That provision has been temporarily blocked by the Supreme Court that decided that kindergarten to a high school education must be provided to undocumented immigrants. Its stature is the strictest in the United States and compares today's Latinos with African Americans of the 50s and 60s. Schools have reported a decline of Latino students attending schools since the law took effect. Georgia's illegal Immigration Reform and Enforcement Act makes it a crime to knowingly harbor or transport undocumented immigrants, impose harsh penalties for providing false papers to an undocumented immigrant, and empowers law enforcement to check the immigration status of anyone that they reasonably suspect to be in the country illegally. In addition, Georgia's laws dramatically expands the requirement for employers to use the federal E-Verify system, which checks the work eligibility requirement of employees. The immigrant law makes it easier for police to check for illegal immigrants, detain them pending deportation, and by such devices denying their children places in state colleges and universities, making it unpleasant for them to stay. In reviewing the challenge to the law, U.S. District Judge Thomas Thrash wrote, the apparent legislative intent is to create such a climate of hostility, fear, mistrust, and insecurity that all illegal aliens will leave Georgia, which in large part many have done. In Hazleton, Pennsylvania, a law was passed that requires tenants to provide they were citizens or lawful residents, register with the city and pay for a rental permit in order to receive an occupancy permit. Landlords could also be fined if they rent to undocumented immigrants. Companies that hire undocumented immigrants could also face penalties. Mississippi is pressing to pass, and I think it actually already has, to pass a bill that makes it a felony for undocumented workers to seek or have employment, as undocumented workers can be sent to prison for 1 to 5 years and pay a fine of up to $5,000. The bill obviously also discourages bail to be provided to undocumented workers. In Kansas, the House voted to repeal in-state tuition for Kansas high school graduates who are undocumented. This law provides in-state tuition for some 400 Kansans who in many cases have only known Kansas as their home. Legislators are trying to deny these Kansas graduates, who are Latino, their right to a university education. In addition, Kansas legislators have introduced a bill that would legalize racial profiling and deny suspected undocumented immigrants citizenship services. In Indiana, the state voted to allow its police officers to question people stopped for infractions on their immigration status. Here in California, our own Governor Jerry Brown, fairly progressive Democrat, perhaps, has taken a position of accepting the federal Homeland Security's edict of abiding to its secure communities regulation. Anyone knows what secure communities is? I'll explain that in a moment. Secure communities actually automatically requires that anyone convicted of whatever infraction, have their identity checked against immigration goals. It gets immediately sent to La Media, to ICE. So not only is there automatically a criminal background check done, but also an immigration status background check. And if you are found to be undocumented, you are automatically referred to ICE, the Immigration Control and Enforcement wing of Homeland Security, even if they have not been convicted of a crime. Numerous states have decided to resist abiding by those regulations, which Homeland Security Janet Napolitano asserts is now mandatory. And unfortunately, California is one of the states resisting is not one of the states resisting implementation of the law. In Arizona, pending new legislation on top of what is already passed would bar illegal immigrants from driving in the state, enrolling in school, or receiving most public benefits. Children would receive special birth certificates that would make clear that the state does not consider them citizens of Arizona. And this is just a sprinkling. This is just a sprinkling of the political and legal efforts to deny Latinos, regardless of whether they are legally documented or not, basic civil and human rights. So how have we arrived at this state of affairs that is so openly acknowledged and touted and indeed supported by a significant portion of U.S. citizens who managed to impose specific modes of governmentality in a social milieu and political context of marked indifference to the rights of Latinos. So this brings me to talking about structural vulnerability and structural vulnerability. In many ways, people living under these particular conditions are never exempt from them, as much as they want to believe that they are kind of have a white light around them and live in a bubble and so on. You're never, ever fully exempt from the effects of living under these kinds of conditions. And indeed, we're talking about the embodiment of externally imposed and produced subordinated states that produces a kind of symbolic violence, if you will, whereby the everyday violence of these imposed scarcities, these legal edicts of insecurity is understood as natural and deserved. Indeed, to understand structural vulnerability, it is important to think of violence on a complex continuum, or perhaps as a set of interlocking linkages of visible and invisible forces, from group overt force to subtle, insidious social terms. So Latinos are under social and emotional duress and experience a sharp gradient that distinguishes the life chances of Latinos according to class, citizenship status, racialized stereotyping, and ethnic hierarchy. By implicating social conditions, structural vulnerability attends closely to those variables and critiques the conceptualization of Latino migrants as criminals, freeloading parasites. Structural vulnerability is not unique to Latino migrants in the United States. It applies to the poor, it applies to the medically uninsured, the sexually stigmatized, people of color, the disabled, the incarcerated, those with drug and alcohol problems, the runaways, throwaways, castaways throughout the world. Experiences of vulnerability, however, are only partially shared across populations because they are shaped unevenly by specific status attributes like gender, age, ethnicity, and different conditions, legal status, economic and living conditions, and individual serendipity. In my research work, many Latino migrants have not set out to the United States specifically to end up in San Francisco, but ended up here after numerous trials and tribulations. San Francisco, as a sanctuary city, relatively tolerant to Latino migrants compared to other places, became a viable alternative to cities and rural areas that, while more lucrative in the short term as relates to work and generating income, have become perceived as extremely dangerous. The fear of being picked up by ICE agents weighs heavily, and although the reality of actually getting caught versus the fear of getting caught is obfuscated by the current U.S. political climate and ethos that have singled out immigrants as a primary source of the social and economic ills that beset U.S. society, in which the routine incarceration and deportation that occurs in places like Tucson becomes symbolic of what is going on everywhere. In my work, undocumented Latino day laborers are excluded from the formal labor sector, the formal labor market, and by their dependency on contingent work. They have limited to no access to health care and social services. The risk environment in which they operate makes them susceptible to suspicion by the law, including mistrust of the government. Many migrants work and live under unpredictable and temporary circumstances that limit their options to meet personal and health care needs. Additional social factors that heighten health risk include constant mobility, fear, poor and unstable working and living conditions, and multiple barriers to obtaining health care. In striving to overcome such conditions, Latino laborers often internalize the very social values they are exposed to and that operate against their self-interest. In one field site I work, a free public sector social service day center, the Mission Neighborhood Resource Center, near the Mission Neighborhood Health Center, where many of you have done work, in the Latino Mission City in San Francisco. They serve a broad, indigent population, not just of Latinos, but all ethnicities, the homeless, mentally ill, substance abusers, individuals on GA, on general assistance, on SSI, Social Security, insurance, and people without any public assistance whatsoever. The center operates during the day, maintains lockers, provides showers, has on-site medical and mental health services, and is staffed with bilingual social workers and counselors ready to assist individuals in need of housing, legal aid, financial assistance, and other vital services. In this setting, undocumented Latino day laborers who are down on their luck mingle with other denizens down and out of urban marginality, with many Latinos with they find little common ground, except for the common poor physical material conditions. Jesus, a young undocumented Salvadoran day laborer, had been in the U.S. less than a year. He said, "No soy verdadero." This Spanish refrain had currency among undocumented Latino laborers with whom we interact. The statement is a play on the ambivalent status of being a recipient of welfare, immediately brought to mind the rhetoric of how welfare in the popular North American imaginary produces social dependencies. It conjures images reminiscent of late President Ronald Reagan's caricature of African American women as welfare queens who cheat on public assistance. The term indicates knowledge of a common accusation leveled at illegal aliens, that undocumented Latinos are here in the United States to take advantage of our generous welfare system. Jesus, who expressed not being a welfarero, supplemented his remarks with furtive glances and quick points in the direction of others in the shelter, especially African Americans. Yo no soy como decir morenos, I'm not like those African Americans. And so while racism by Latinos toward African Americans is not new, the conflation of race with the disreputable status of welfarero, or welfare person, solidifies the structural association of class with race and behavioral associations of work ethics and social status with race. These associations link the politics of race with citizenship inequality, even among people of shared ethnicity. It must be remembered that structural vulnerability is socially and politically constructed and becomes externally imposed upon those most stigmatized and marginalized. And today that is simply the case for Latino population. How we counter this ongoing construction, whether constructing alternate discourses, humanizing Latino migrants as worthy human beings, and making clear that this legacy must stop, requires an ongoing commitment to social justice. The discrimination, lack of empathy, and intolerance migrants confront as a result are all lived effects of the structural vulnerability, not only that migrant laborers face but experience, and can no longer be denied, minimized, or shunted to the side. The consequences exacted by social exclusion, criminalization, and indifference are harmful to all, most obviously to migrants themselves. What is increasingly apparent, however, is that the near and long-term injurious effects shapes the attitudes and understandings, behaviors and practices, not only of migrants themselves, but also the local communities in which they are embedded, the social institutions with which they must interact, and the service and medical providers who may or may not serve them. Despite popular and official perceptions that Latino migrants overutilize medical services and purposely migrate to take advantage of health and social services, it appears that the undocumented use fewer medical services than citizens, often to their detriment. For instance, when they wait until they are very sick to seek medical attention for fear of being discovered, and then when they do, they go to emergency room services. The forbearance of local communities and social institutions is put to the test when they are charged with determining deservedness and providing services commensurate with the contradictory national immigration and health policies, especially when the cost of not conforming and not doing so include the threat of losing funding, delayed reimbursement, increased workloads, and the systematic curtailment of services. The exclusion, criminalization, and indifference migrants experience are compounded as they move along among the various contexts: hostile territories, institutional spider webs, unregulated labor markets, inhospitable social and legal environments that ultimately negatively implicate all of us. Although the phenomenon of structural vulnerability reaches far and wide, for some like undocumented migrants around the world, the harm and distress are disturbingly great. For migrants, the conditions of illegality or the suspicion of being illegal and subsequent vulnerabilities vary from locale to locale, nation to nation. Yet the consequences are all too common. Juridical systems that systematically criminalize migrant individuals and communities, socio-political processes and institutions that incessantly create newer systems of exclusion, control, and regulation, moralizing discourses that legitimize disenfranchisement. Latino migrants are constantly on guard to avoid being found out, even if that meant acting in ways that endanger their health and well-being. They live in a chronic state of risk, not simply because they sometimes act in ways that are harmful, but also because of the multiple risks social inequality imposes upon them those living in risk environments where they are relegated to low-paying, dangerous jobs, ineligible for social benefits, and provided little to no means of overcoming their liminal illegal status. Structural vulnerability limits human agency and discloses how little control individuals have over their environment. And the vulnerabilities migrants endure produce ill health. This results not only from living in a social milieu that is markedly indifferent to or disdainful of them, and that justifies their mistreatment, but also from the structural violence that they experience on a daily basis. The other thing that I think is really important to understand, and I'm going to sum up here, regarding structural vulnerability, and as I mentioned earlier, this is not something that is particular to Latino, particularly undocumented Latino migrants, but to multiple communities and multiple populations. And a good portion of the work that we're doing is really trying to get as robust sense of just what are the actual social and health consequences of structural vulnerability. And if you're interested in this, I just recently co-edited a special issue of medical anthropology in December that was completely devoted to this concept of structural vulnerability, mostly dealing with Latino migrants. And I also have a commentary, it just came out last month, a social science and medicine special volume that is looking at issues of structural vulnerability and migrant laborers internationally. So this is not something that is particular to the United States, but it is because of globalization and the unruliness that is going on around the world. The heightened phenomenon of xenophobia, the fear of strangers, and the kind of laws and rules that emanate from that are just being multiplied over and over again. Anyway, I hope to hear some comments and questions.